Welcome back to our channel, Dr. Stethoscope. Today we are going to discuss about the second cervical vertebra. Last class we have explained more about the first cervical vertebra named as atlas, and here comes the second one, axis. So I have already tell you about how the axis and atlas is related by joints. They have atlantoaxial joint in between axis and atlas, so they have intervertebral disc. From atlas axis onwards, there is a presence of intervertebral disc. They are having intervertebral disc in between all other bones. So we can get more about that. Second cervical vertebra is identified by dens or odontoid process. I have already tell about that. Dens is a exclusive character of atlas, axis. This is the odontoid process or dens explained here. Dens or odontoid process. It is an or name. You can neither call it as dens or neither call it as odontoid process. So dens is in superior surface of axis, articulate anteriorly with the oval facet on posterior surface of the anterior arch of atlas. So I have already tell about the last class. I have already tell how the dens is attached to the atlas. If you have any doubts, you can go back to the lecture and you can see how I have explained there. I have explained very accurately there how the dens is attached to the oval facet of atlas. So I will show you the each and every part of axis. This part 3 named as is called as axis dens. This is known as dens of axis. Dens of axis. This is facet, superior articular facet, Then we can see that foramen transverse area here, foramen transverse area. Then you can see that transverse process over transverse process, and the foramen foramen present in transverse process is known as foramen transverse area or foramen transverse area. Then here you can see that vertebral foramen. Then here it is inferior articular facet. You can see that inferior articular facet over there. Then here there is a special character in axis, specially only for axis. So not for only axis, all the other cervical vertebrae, but atlas doesn't have. So axis is from axis onwards to C7 having bifid spinous processes. Bifid spinous processes. This bifid means it is two. They are divided into two part of the spinous processes. It is also character of cervical vertebra except atlas. So here is the general characteristics of axis. Lamina is thick and strong. You can know that by the figure itself we can identify how thick is the lamina. Lamina is very thick. Transverse processes are very small and represent two posterior tubercles. You know that atlas is having tubercles, posterior tubercles and anterior tubercle, but here axis is represented by the presence of transverse process gives the represents of posterior tubercles. So transverse process is acting like posterior tubercles in axis. Spine is large, thick and very strong, deeply grooved inferiorly. Tip is bifid, terminated in two rough tubercles. I have already shown that here two rough tubercles are presented. So they are very thick. Spine is very large, thick and very strong, deeply grooved inferiorly. So and having a rough tubercle of the end of the spinous processes. So we are going for the next part of the axis, the clinical session. Clinical session is many clinical sessions are for cervical vertebra. For making the class interesting, I have taken one of the clinical scenario here. You can see that hangman fracture. Hangman fracture occurs due to the fracture of odontoid process or of axis vertebra. When we are hanging, I will show you here. When we are hanging, From here, it may fracture. Do you know how? Because if I'm giving an example, if this is atlas, if this is atlas, and if this is axis, the atlas and axis is represented like this. If atlas is this and axis is this, then when we are hanging, the atlas will move forward and the axis will the axis will move forward and the atlas will move backward. So when the axis is moving forward, that means that the pressure between the dense part, the pressure on the dense part make the dense become to fracture. I hope you have understand that. I will explain more. I will go to another presentation. Here, look. Here the dense and atlas is attached. Atlas is attached with the dense of the axis. When hanging occurs, here this atlas bone will become backwards and axis will move forwards, which forms pressure between the area of the neck region of the odontoid process may get fractured. I have explained about that. So I hope you have understand that a hangman fracture is the fracture occurs when the odontoid process is fractured at the time of suicide or hanging. I hope you have understand. It is a fracture of odontoid process. It is a fracture of odontoid process. Okay, I hope you have understand. These are the main topics of axis and I have explained about that. So I hope you have understand. The most important part of axis is that having the presence of dens and the importance of the bifid spinous processes in axis where atlas is don't having. And I have already told that there is a joint between atlas and axis. Joint between atlas and axis is called as atlantoaxial joint. Atlantoaxial joint. Don't forget the joint between the axis and atlas and having intervertebral disc between them. So I hope you have understand the lecture. If you have any doubts regarding the session, you can ask me on comment box and feel free to ask me anything. And so I have to wind up this lecture. Next day coming soon. Next video will be uploaded soon. I hope you all understand the session today. See you in next class.